guys, I'm Dr. Buffy, and over the past several months, I've been hearing from facilities across the country about the increase in confusion about when to use PPE on a non-COVID ward versus a COVID ward, how to reuse PPE, and it's just confusing. For example, one nursing home that I was in, I was talking to the nursing staff and they actually said, we don't know when to reuse it, we don't know how, and they were just really confused. So in this video, I'm going to describe some tips and tricks on how to appropriately utilize your PPE. First, it's really important that you follow your local county and state regulations regarding reusing PPE. For example, if you have a resident that's admitted to your facility, they may require a special PPE. They may require contact and droplet precautions in your county versus maybe another county or state may not require that. So it's really important that you check with your county and state officials and make sure you're following your protocols correctly. So what PPE do you wear for residents that have COVID status and perhaps even your quarantine unit where the status is unknown? For contact and droplet precautions, you need to make sure that the staff are wearing a gown, gloves, the mask, and eye protection. The eye protection can consist of goggles or a face shield. You don't need both, but it is critically important that you have eye protection. The mask, make sure you're following whatever your policy states. So if your policy is following CDC current guidelines that state that you can wear a surgical mask if they're not aerosolizing procedures done, then you can wear that. Otherwise, if you're wearing an N95 mask, make sure you have that proper fit testing completed as an OSHA requirement. On your quarantine ward, or also known as your step-down ward or your warm unit, these are all different phrases for basically the unknown status of our residents. We don't know their COVID status. With those residents, if you're reusing your gowns, you must doff your gowns in between every resident room. And to do this, you can hang little hooks inside of each room labeled Nurse 1 and CNA 1, or however you label your staff, to use that gown for that resident only. You do not reuse the same gown in between resident to resident to resident. That is an immediate jeopardy, and you will be cited for that. When working in the COVID positive ward, which I actually think is easier when it comes to optimizing your PPE, because you actually can wear the same gown in between each resident. You don't have to don and doff the gown unless it's soiled or torn or visibly needing to be changed. The only catch to this is you can only reuse it as long as the resident doesn't have another co-infection such as C. difficile that would require specific contact precautions for that resident. So keep in mind that when on that COVID ward, as long as there's no other co-infections, you can reuse that same gown in between every resident room. Many facilities are having to reuse their N95 masks because the supply chain just isn't there to be able to have a mask after every single resident use, which is our normal infection control protocol. So how do you safely reuse the mask? One technique that you can do is have what's called passive decontamination, and you can rotate the mask through every several days. So for example, have 5 masks and 5 paper bags. For every day that you use a mask, put it in that paper bag and label the date. And then, so if you have it on Monday, then say wait 5 days and you'll wear that mask again. And that way it's had 5 days to passively decontaminate. This technique is going to help protect your staff in not wearing potentially contaminated N95 masks. If you're interested in educating, monitoring, and screening staff, check out my next video. Let's talk PPE! You better not put that anywhere. I just wish I wasn't so nervous in front of the camera. Oh, this is so good. I say that because it's just so important. So good. I just want everybody to know these things. Because I see people, like the facility I was at, they had PPE gowns stacked on each other. And I told the administrator, throw them all away. They're all contaminated. Like you can't store them all on top of each other.